I would wish that we first begin by defining what is community-based hospital rotation. And we can say community-based hospital rotation is the placement of these health professionals that we are training in health facilities located in the rural areas or in urban and underserved areas. Urban underserved areas. When we talk about underserved, it is where the health professionals, the qualified, are not adequate, and also the resources in those areas are not adequate for that use. For this presentation, we will define hospital rotation. We can also be referring to it while you are talking about clinical placement, clinical training, and our reference point here is in rural health facilities. To introduce the presentation, I wish to mention that while we prepare our health professionals, we know that we rely heavily on clinical training, and we need facilities for clinical training. At the same time, this is because when we look at clinical training, it is very, very important because the students or these health professionals that we are training, they need to have an experience with the patients. For us, we are talking about clients in our communities, okay? It is our communities, our populations, and that is very, very important. What is also very interesting to note is that there is a growing trend towards providing care in small community-based clinics instead of referral hospitals or academic hospitals. That is where our students also train. The traditional sites, the clinical sites that we use, for example, like the referral hospitals and the academic centers, even while we look at it, the service that is provided there or the facilities that are there serves a very small percentage of our population compared to the populations that are left out there and the facilities that are out there. So the hospital facilities that we can call as academic centers or referral hospitals are very few compared to other facilities. When you look at our infrastructure in terms of healthcare provision, from the bottom, when you talk about provision of health services, we have the community, then we come to primary healthcare facilities, and then we have the sub-county, and those ones, they serve a larger population, and there are many. Those facilities will be many compared to when we come up the ladder when you're looking at the facilities. So to address the issues of shortage in workforce in serving our communities, and also at the same time meeting the needs of our trainees that we train, it is important that we begin thinking about utilizing these rural health facilities that we have in training our students. So what is the importance of clinical training in community-based settings? These community-based settings, they give our students, who are the health professionals that we are training, a unique health center. While they train there, they are exposed to unique health center needs of our populations. Okay, and through this kind of experience exposes them or prepares them to serve these kind of communities. Even while we train, at the end of the day, they are supposed to provide care. Okay, and if we look at provision of care, for us who are community health specialists, our focus is on preventive and promoting health services. And so while we give them an opportunity to train there, at least they can be interested in serving the community. Even at the same time, while you look at the importance, there at the rural health facilities is where they get the real world situations, because it is the community that does or identifies its needs and come up with their interventions. At this point also, at the same time, we will expose our trainees on having an understanding of the effects of physical and social environment on health. And research has shown that training in rural and underserved areas also leads to practice in those areas. The last point there about the importance of clinical training is that while we train our students, it will help them develop systematic approaches whereby they will assess the health problems of the individuals in the community and come up with activities like health promotion activities, and even understand what resources the communities or the families have so that they can utilize them to address their problems. So part of our current challenge in clinical training is the issue of numbers, number of healthcare professionals that we are training. There are many in relation to the training facilities that we take them. And just to show some literature is that it is from some surveys that were conducted, schools of nursing and medicine have reported concerns about insufficient number of sites and also receptors while we train our students. And while this is the case, we have an opening whereby we can utilize these community-based facilities to train our students. So CARES program is a program that we use in School of Medicine, Pharmacy and Nursing while we take our students on community attachment, which we are going to look at it here as a community-based clinical training, and that is what it is. It is an attachment that the students go for while they're on training, and during this attachment, they are conducting research while they are also doing what? Providing what? Service at these community-based facilities that they have. So normally, sometimes as schools of medicine, nursing and pharmacy, like the previous time, we've worked together to coordinate the program. So it is not normally an individual kind of school activity, but we work together when our programs are flowing together. And we have a component of theory, then there is now the practical aspects. In this case, we have year 2s and also year 4s, and for medicine it is year 5 that go for attachment. Now for the activities that they have while they are out there for community-based hospital experience is that we have activities that are conducted in the hospital facility, and they also go out for community activities. Wish just to go ahead and show in a table of this format. We normally organize our activities in relation to the number of weeks that they are there, and we match both activities that are done within the hospital and the ones that they go out for experience. I want to hope that you can see from the back. I don't know whether you're in a position to see. So these activities, just to mention the OPS, it is where now they are serving, they are working at the clinical facility. OPS means observe, participate, and do what? Serve. Okay? So first of all, before they begin doing an activity, okay, they observe. For example, if it is about clerking a patient, they listen while the doctor is clerking a patient. They observe how it's being done. Maybe the doctor will conduct an assessment, take some history. They observe. After they've done that and maybe document and come up with a diagnosis, then they should be in a position to do what? Participate. And after that, we want to believe that they have gained the skill and they can now do what? Do the same. So these are just, I want to believe that we've gone through week 1 while I was still talking. Then we have week 2 activities. I've mentioned that we merge both hospital activities with what? Community activities while they go out. One that is of importance I want to mention is home visits. Home visit is an aspect that we introduced at School of Nursing. This is whereby students select a family, okay? A family that they would have interacted with them at the health facility while they were serving them, okay? And they've seen that there's a need for them to follow them up at home so so that they can do an intervention. Okay? Or sometimes we would also just send students to visit homes, conduct assessment, and see what to improve in that family for the sake of health, okay? To promote health and to prevent disease. Then we have week 3, a component that has come out here is community diagnosis, which I'll just talk about it in a short while. And week 4, activities, which also has a community diagnosis. Now, just to show a few, I think it is because of lighting. These are some of the community-based clinical training activities. Inspection of sanitary facilities, those are our students with a community member. Then you also have inspection of water source, that's a spring. Then also education on water and sewerage treatment process. We also take our students for that learning experience. I wish just to present a little bit on community health diagnosis, which we are looking at it as a component of community-based clinical activity. Community diagnosis is whereby the students appraise the health status of a community, or whoever who wants to conduct the study will appraise the health status of a community, and it will involve so many things. The person, especially now we are talking about our learners who are the healthcare professionals, will take vital statistics. They will also look at health-related statistics and also information pertaining to determinants of health, and look at these determinants of health, whether they have relationships, okay, in relationship to health. The aim of community diagnosis that we conduct, okay, helps the learners to understand so many things about the community. They understand their cultures, their values, their norms, leadership and power structures, means of communication, helping patterns, important to community, institutions, and history. So it is very, very important when you're out there to interact with the community and you can actually feel the power structure sometimes, okay, while you go out there to guide students. Some of the community assessment methods that we use are the surveys, descriptive epidemiological studies, and we also use tools to conduct studies like key informants interviews, focus group discussions, okay, and we also take measurements. So these are the nursing students ready to go out for community assessment, part of community diagnosis. They are having weighing scales, and I think they are waiting for transportation to their destination. Some of the data that we collect in the communities while we conduct assessment and diagnosis is on characteristics of the community, and environmental characteristics, social economic, and the list just as highlighted there. So I wish just to present a community diagnosis report, and the essence of this is for us to appreciate the issues of health-related activities, so that a student or our learners can come up with a diagnosis of some sort. So I just picked one of the community assessment and diagnosis that was done in 2022 by our students who are rotating in a place called Sabatia, which is in Vihiga County. Part of their demographic info, let me not talk about demographic, part of their vital information that was important was about the total number of staffing in the hospital. Now, you will notice that we used a sub-county hospital here, not a rural health facility. Why? It is because this station was upgraded to a sub-county hospital, and while it was upgraded, they have a very good structure of community activities, and they are very active in community-based kind of training and activities. And so we still use it as a rural health facility for training our students. You must have gone through the personnel of the facility So, and the services that they provide in the facility are just as indicated, outpatient, inpatient, but the inpatient services are just for maternity and general admission just for a short time. After the mother has gained stability, then they are free to go. You want to tell me to stop? All right, thank you. But I'm sure I'm audible, isn't it? Okay. So this health facility serves a population of, the catchment population at that time was 26,659, okay? With those categories that have been highlighted there as the population, okay, of the population. Now, just to highlight something about attendance at the health facility, just for the months before attachment and after, we can see the number of patients that were seen at the outpatient. Special clinics, you were seeing there was a month that there were no what? Services, okay? This is because now what the gap that we were talking about that is not there for community-based, okay? That is why we want to say that we need to train our students in this rural or community-based health facilities so that they can see the need of going to serve in the area, okay? Even the dental, you can also see there was a month that there were no patients that attended, most likely because maybe there was no what? Attendant to serve them, okay? Now, just to highlight a little bit of the findings of the community assessment and diagnosis, is that they visited students here, they visited 3 villages, and at the end of it, we realized that the ethnic grouping of the Sabatia community is what? Maragoli and what? Maragoli, and the historical events, it's about where they migrated from, okay? And it's about 2 brothers who formed 2 different clans, the Gusi clan and the what? Maragoli. The Gusi clan migrated to Kisumu, but they were advised to move to look for fertile land and they settled in Kisii, okay? Then the Maragoli, they decided to hang around where? Sabatia. So these are kind of interesting info that you find when you're out there in the community, and it forms part of the history, and that is the information that is important to us as healthcare professionals. Then major economic activities for these people in Sabatia: farming, livestock, farming and trading, and cultural practices, male circumcision, wife inheritance, and what? Polygamy. For us who belong to some communities and who are in Kenya, we know the kind of celebration that comes with the male circumcision in that region. They can even block the road while they are while they are escorting the hoops to the river, okay, for the initiation ceremony. So it's actually an event, okay. So some of the qualitative data that we also gathered from this community, just to highlight here, it's about sampling how the 100 households were obtained from the 3 villages, and what was important is the conclusion, okay? What came out from the community diagnosis is that teenage pregnancy was a major concern in this area, okay? So from the findings after analysis, teenage pregnancy was an issue, okay? Dietary diversification was not also being implemented in many homes, okay? When you talk about dietary diversification, is whereby they will have a group of food and they only have that one, okay? For example, maybe their menu would be ugali, okay? Or corn with vegetables, okay? And they would just only have that one and a little bit of milk, okay? So, and while you look at it like it's balanced, but if you would have diversity from the same food groups, okay, then you would get other essential minerals and other nutrients from other foods that you're missing if you would have had a variety instead of just having what? One type of food. Exclusive breastfeeding was also not adhered to by many mothers, okay? And there were some positive aspects that families had maintained a high percentage of immunization, okay? They brought their children for immunization and also to the welfare clinic, which was important and was positive. And also the mothers also saw the importance of hospital delivery and also coming for antenatal care. So at the end of it all, what I want us to look at it from here is that we have gotten some aspects that we can diagnose this community, okay? And it is about issues of teenagers, okay? Maybe now something would be looked around. What is it about teenage pregnancy? What predisposes the what? The girls to this? Could it be because of what? Low levels of education? Could it be because of poverty and any other thing, okay? So I would wish to invite my colleague now to look at the other aspect while we continue presenting.
Okay, mine is simple. You know, speaking after my boss is not easy, but I'll try. So I'm handling the limitations of CAS, and these are not new things. So you find that just as the first presenter presented, these students, especially for CAS, will rotate for 4 to 6 weeks. And that will not give them a proper exposure about the community. They may not be immersed in all the aspects within the community, so there'll be that limitation. Another constraint will be the resources. You find that this requires funds, and also maybe the infrastructure within the facilities may not be sufficient enough to support learning. Another one is geographical accessibility. You find that there are some facilities which are hard to reach. They are so remote, and you find that some of them may not offer convenience, maybe when you are mentoring these people, the learners in those places. The other thing is variable learning opportunities. We know that these facilities may be having different aspects. A facility in a particular place may not be similar, maybe infrastructure-wise, to another facility in another place. So that can create variance. And then another thing is supervision and support. This requires human capital, like it requires maybe the expertise on what you need to do when you are in that facility. Another thing is evaluation challenges. We might have situations whereby we don't have a standardized means of assessing maybe the attitudes when they're in the community, the skills, and the knowledge. Another one is limited generalizability. You find that maybe what works in Maseno may not work in University X. So you find that there'll be that problem with generalizing. Another one is sustaining this program may be a challenge in that it will require maybe some resources, and also the spirit of the people who are maybe offering this CAS program. They need to be motivated so that they can sustain this program. So lastly, going to the recommendations, this program, the CAS program, needs to rely on current evidence. So we need to keep on looking at the recent aspects, the recent literature, to confirm or to see what's happening maybe elsewhere and what works. And then this program also requires empowerment of the faculty. So they need to be empowered, they need to be trained so that they're able to deliver. Technology matters a lot, especially in the contemporary society. You find that we have new technology, so we need to embrace the technology. We also need to develop partnerships for this program to succeed. We also need to work as a team to collaborate. Maybe the different specialties needs to work together so that this program can be a success. And then student support services, you find that students will need to be mentored, so we need to have mentorship, counseling, and also the resources which are required. And then there needs to be continuous improvement, quality improvement of this program, so that we're able to see the outcomes from the students, the community health indicators, and other aspects which are relevant so that this program succeeds. So in conclusion, CARES program has been shown to be, should be adopted in training health professionals as an effective and practical method of training healthcare professionals to meet the challenging needs of communities, to improve healthcare professional skills and empower them to address the healthcare problems. So up to that point, that's the end.